Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research investigates sciatic nerve injuries in our beloved canine and feline companions, exploring the various causes of these injuries and the effectiveness of different diagnostic tools in predicting the long-term outcomes for these animals. Sciatic nerve injury, often abbreviated as SNI in medical literature, is a topic of considerable importance for veterinary professionals and pet owners alike, as it can significantly impact an animal's mobility and overall well-being. While reports on such injuries and their consequences are somewhat limited in the realm of veterinary medicine, this study provides valuable insights into this condition. The sciatic nerve is a major nerve in the hind limb, essentially formed by the close association of the tibial and common peroneal nerves. These two branches can separate at various points along their course, from the hip joint down towards the space behind the knee. Depending on where an injury occurs, either one or both of these branches can be affected. It has been noted that injuries impacting the main trunk of the sciatic nerve or both the tibial and common peroneal branches tend to have a less favorable outlook. Regardless of the specifics of the injury, the eventual outcome is strongly influenced by the severity of the damage at a functional level. For instance, if there is a complete severing of the nerve fibers and the surrounding connective tissues, a condition known as neurotmesis, the prognosis is generally poor. In contrast, axonotmesis, where some nerve fibers are damaged but the connective tissue framework remains intact, presents a more variable prognosis. Finally, neuropraxia involves minimal structural damage, often just a localized disruption of the insulating layer around the nerve fibers, and these cases typically see a spontaneous recovery within days. However, the return of function can take weeks or even months, depending on the distance the nerve needs to regrow to reach the affected muscles. To better understand the extent of nerve damage, veterinary neurologists rely on thorough neurological examinations and electrodiagnostic tests. These tests help estimate the functional impairment of the nerve fibers. While such methods have been used to predict outcomes in other types of nerve injuries, such as those affecting the brachial plexus in the front limbs, specific investigations into their predictive power for sciatic nerve injuries in dogs and cats have been relatively scarce. Furthermore, there has been a lack of information regarding the quality of life experienced by these injured animals and the perceptions of their owners. Therefore, the primary goals of this study were to describe the causes of sciatic nerve injuries and the clinical and electrodiagnostic findings in a group of dogs and cats referred for this condition. Additionally, the researchers aimed to evaluate whether the results of neurological examinations and electrodiagnostic tests could predict how these animals would recover. Finally, the study sought to understand the quality of life of the affected pets and the perspectives of their owners. Now, let's turn our attention to the fascinating results uncovered by this research.
Building upon the introduction, this study meticulously analyzed data from 38 dogs and 10 cats that had been diagnosed with sciatic nerve injuries. The researchers carefully reviewed their medical records, which included detailed information about the cause of the injury, the clinical signs observed, and the results of comprehensive neurological and electrodiagnostic evaluations. These evaluations often involve techniques such as electromyography, which assesses the electrical activity of muscles, and motor nerve conduction studies, which measure how quickly and effectively electrical signals travel along nerves. The time between the onset of clinical signs and the electrodiagnostic evaluation averaged around 67 days for dogs and 65 days for cats. The study revealed that the most frequent causes of sciatic nerve injuries were surgical complications, accounting for 42% of cases, and trauma, responsible for 33% of injuries. Interestingly, in dogs, a significant portion of the trauma cases, specifically 24%, were attributed to bites from wild boars. The ability of the dogs to actively flex and extend their hock, which is the joint equivalent to our ankle, was found to be significantly linked to a positive recovery outcome. The electrodiagnostic evaluations provided further valuable information. A specific measurement obtained from the motor nerve conduction studies, known as the compound motor action potential or CMAP, was found to be predictive of outcome in dogs. Specifically, a cutoff amplitude of 1.45 millivolts for the CMAP was indicative of a positive outcome. This means that dogs with CMAP amplitudes above this threshold had a higher likelihood of a good recovery. This cutoff point showed a sensitivity of 58% and a specificity of 100% in predicting a positive outcome. This suggests that while a CMAP amplitude above 1.45 millivolts strongly indicates a likely positive outcome, values below this do not definitively rule it out. In cats, the study found that the absence of severe spontaneous abnormal electrical activity, graded as 3+, in the quadriceps muscle during electromyography was the only independent predictor of a positive outcome. This suggests that the degree of muscle denervation, as indicated by the electromyography findings in a specific muscle group, can provide prognostic information in feline sciatic nerve injuries. Furthermore, the study explored the owners' perceptions of their pets' quality of life following these injuries. Interestingly, owners generally reported a good quality of life for their animals, even in cases where a hind limb amputation was necessary. This highlights the remarkable adaptability of pets and the strong bond owners share with them. While some owners felt that their own quality of life had decreased, the relationship with their pet often remained unchanged or even improved. In conclusion, this research underscores the importance of both clinical assessments, particularly the ability to move the tarsal joints in dogs, and electrodiagnostic findings, such as the CMAP amplitude, in predicting the recovery of dogs with sciatic nerve injuries. The proposed CMAP cutoff value may assist veterinarians in making more informed decisions about treatment strategies and providing owners with a more accurate prognosis. For cats, specific electromyography findings in the quadriceps muscle appear to be a significant indicator of outcome. Overall, the study highlights that while sciatic nerve injuries can be challenging, clinical motor function appears to be a stronger predictor of recovery than sensory function, and electrodiagnostic tests play a crucial role in further refining our understanding of the likely outcome. The encouraging reports of good quality of life, even in severe cases, provide reassurance to owners facing this difficult situation. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.